can give you all a few minutes to put your guesses in. You can pop them in the chat.
Yeah, it looks like someone came up with it. It was called the Tualatin District until it became known as Washington County a few years later. So,
Interesting.
yeah, fun fact for the day.
Thank you, Adam. I would have never guessed that. Thanks. Okay. Well, it's 8:33. I think we can get started. Welcome, everybody. If you could enter your name, your pronouns, and your agency into the chat, that would be great. Okay. And Happy New Year, everybody. To start us off in 2025, HSSN will offer monthly agency highlights on the agenda. This meeting will hear from Boys and Girls Aid. If you or your agency are interested in offering a presentation during our HSSN meetings, please reach out to Lindsay, and Lindsay will drop her email in the chat for you to reach out to her with that email. The public comment process. So before I remind you of how we do that, I just want to let y'all know that we're working on making it a bit more structured. But for now, I just want to let you know that there if there are like social events or advocacy, organizing events, those sorts of things, you can share those during the public comment. And you should just let Lindsay know. And if she confirms, they can, you would be able to share a link or an email in the chat. So social events, advocacy, or organizing events, we love that that is being shared in that space. Just make sure you run by Lindsay if you are interested in sharing a link or any emails in the chat so that she can confirm. Okay. So that's just a little update for now on the public comments, but just a reminder, as per usual, if you would like to make a public comment, there's two different ways to provide feedback and comment on our house's system. So you can submit a comment from the link on our HSSN webpage, or a standing public comment item has been added to our monthly meeting agenda. Comments are limited to 2 comments per meeting at the designated time. Each comment is given 2 minutes. So at the end of 2 minutes, I'll just pop in and say, hey, let's, elevator pitch, wrap it up. Me and Adam will work with the county staff should the public comment process need refinement, which we're kind of doing right now. So yeah, to request to make a comment during a HSSN meeting, you can direct message your request in the chat to Lindsay Dent. Please do that by 8:45 a.m. So you got about 10 minutes if you'd like to do that. Include a topic, description, and the organization you represent. The first 2 requests received will be provided an opportunity to speak for 2 minutes. Additional comments can be submitted through our online public comment link. And if attendees do not request public comment, they will need to follow the link. We can't allow an open floor during the public comment section of the agenda. So if anybody has a public comment they would like to make, please go ahead and inform Lindsay by 8:45 a.m. And let's move into our program update. So Nicole Singh with the Homeless Services Budget and funding updates. Nicole, whenever you're ready, you can take it away.
Thank you, Sharon. Hello, folks. It's good to be with you. If you haven't met me, my name is Nicole Sting. I use she, her pronouns. I'm with Washington County's Homeless Services Division. It's great to be with you. I know Jess Larson, our assistant director, was here last month. I'm here to just continue that truth and transparency, providing updates on public meetings and conversations in regards to SHS funding. Before I do, I just want to give a brief update. I know a number of folks that are on the line are tracking Metro's potential SHS referral measure. I want to just give a brief update there. On Friday, this Friday, Metro is reconvening the stakeholder table that initially helped them think through some options back in last spring. I'm putting the link in the chat here if anyone's interested in tracking that. Just wanted to share that there's a public meeting happening around SHS and make sure you all were aware of it. And with that, I'll go into putting that aside and go into our reality of SHS funding. As many folks know, we are facing reductions in the revenue forecast of around $16 million per year. It changes a bit, the forecast moves, and this is not out of line with what we expected with SHS forecasts, and it does represent, however, the worst case scenario. This is what the worst case scenario of what we had already been planning for. To all of folks that work at our SHS contracted agencies, I want to say loud and clear, we are working with your executive teams on this. We're having regular conversations about the impact of reductions, and I want to encourage you, if you are one of our SHS providers, to work with your leadership and management if you have questions about what might be coming forward. They've been engaging with us and helping us think through these questions, along with, of course, our Board of County Commissioners and the Solutions Council. So the latest news was yesterday's Board of County Commissioner meeting, where we presented the information that Jess Larson shared with you last month. It was a productive conversation with our board. Generally felt that we were heading in the right direction in terms of the programmatic cuts that are under consideration, and they also understood that we're having additional conversations with our provider community and with the Homeless Solutions Advisory Council. Last month's meeting, I'm going to put another link in the chat. Last month's meeting, we dove into what some programmatic reductions could look like in the next fiscal year. We're going to continue that conversation in a greater level of detail this upcoming meeting. So the materials are not yet ready or posted. They should be ready sometime on Monday or Tuesday next week, so feel free to bookmark that link and revisit it. But want to make this group aware of these conversations. If you're interested in learning more, I encourage you to join the Solutions Council meeting. There's a webinar link where you can come in as an attendee and watch the conversation. We're also in person. It's a small room, but anyone is welcome to join us. So those are our brief updates. If you do have any questions, let me know or let someone on our team know. And if you are an SHS contracted entity, I want to just again encourage you to reach out to your leadership and management. There's a lot of unknowns right now, but they've been part of our conversations and part of those discussions.
Thank you, Nicole. Are there any questions for Nicole? Any quick questions? No? Okay. Oh, Jorge, go for it.
Yeah, hi Nicole. Thank you for sharing. I know you said you're going to provide information like material next time, but can you give us a preview as to what to expect with these potential reductions in just funding?
Yeah, I'll provide a bit of a preview, and what I might do is just put in the memo we provided to our Solutions Council at the last meeting. What's coming up next is, and that's that link in the chat there, what's coming up next is additional conversations with Solutions Council, kind of a greater level of detail about what potential reductions might look like. Again, this is all happening fairly quickly. We have to put our budget together by February, and there's additional work to do to take our broad budget categories and help understand where the capacity might live for organizations. So it's going to be a long process where answers are not quite ready when you want them to be ready, but would just encourage folks to follow the Solutions Council and continue to come to spaces like this to hear updates.
Awesome. Thank you. Okay. In the interest of time, I'm going to move away from questions because it sounds like they're still, yeah, working on it. But Shayla, I did see your hand. Maybe you could message Nicole in the chat and she can help you with your question. Unless it was a public comment, that you can reach out to Lindsay. But let's move on to our speakers for today. So our first speaker is Sonara Blackwood, the System of Care Supervisor, going to be talking about Washington County Crisis Services. Sonara, whenever you're ready, go for it. And I hope I pronounced that correctly.
You're great. Hi, thank you, Charlie. Yes, my name is Sonara Blackwood. I use she, her pronouns. I am with the Behavioral Health Division in Washington County as a System of Care Supervisor. I'm going to hopefully successfully share my screen. So let's see if I can get that up and rolling here. And I'm showing that it's up now. So if anyone does not see it, please say something. But yeah, so today, what I'm hoping to talk about is just the crisis services here in Washington County, the supports that are available. And we'll go into the agenda a bit more, but just to give you all some context as far as the System of Care team and the Behavioral Health Division, what we do on this team is we support the development and funding for all mental health services across the lifespan, as well as prevention and intervention support. So that's why we're talking about crisis today. As the supervisor for this team, I support the management of the crisis services with our providers in the community. So we will go into that a bit more, but thank you for having me. Excited to be here. I think I've seen some of these names that may have come to a recent crisis presentation. So this will be a little different, less into the weeds than the crisis presentation if folks attended that. And I'm just hoping to open up for questions that people might have. But yeah, today we'll talk about how can crisis services help, whether it's yourself, someone you love, or someone you're meeting in the community, or someone that you are helping in your job role. And then also, how do we access crisis services, as well as what are some suicide prevention, mental health trainings and opportunities that are available so that you can feel as equipped as possible when encountering someone that might be experiencing a mental health crisis. And as mentioned before, then open up for some questions. So, and hopefully this is big enough for everyone. I don't put it in presentation mode because then I can't see everyone's faces. So, but if it is not doable for you all, just let me know. I'm flexible. But yeah, so crisis services here in Washington County are all staffed by behavioral health professionals. And that can be someone that has a master's degree who is a clinician. It could be a peer support specialist that's certified through the state. And it could be someone that also has a degree in substance use counseling. And these crisis services are provided at no cost for the community. So the first one that most are familiar with, because it's been around for a long time, but I will say from a recent survey we just did for crisis services, we learned that actually only about 44% of our population that responded to this survey, this was community-wide and provider-wide, were aware that we have a crisis line that's 24/7. So just want to highlight this you'll reach a mental health professional, someone that has a master's degree, clinician specifically trained in supporting folks that are experiencing a significant mental health crisis. That can be psychosis, that can be suicidal thoughts, homicidal thoughts. It can be, I can't even leave my house. The person defines the crisis, and we'll go a little bit more into that. So there really is no wrong reason to calling the crisis line. If it's not the best support, then they can help get folks connected to the place that might be more helpful. But yeah, so you'll have a clinician that will listen. They'll assess for immediate safety concerns. and then offer support and some safety planning to see whether or not it might be helpful to come in and see somebody, or they might be beneficial for this person to go to the hospital, or just create a safety plan with even their natural supports or with themselves. So really depending on whatever it is that person needs. And then also make referrals to local resources and treatment. One benefit too that could be beneficial to know is that we have crisis alerts. And so if there is someone that you're working with, and it would be helpful for the crisis line or even our mobile crisis services to be aware of any mental health needs that this person has, and or beneficial and successful ways to work with this individual when they are experiencing a crisis. That's something that the provider can fill out, and then that would be made accessible to the crisis line we contract with. And it would be made accessible to our mobile response team. So they would be on the same page as the provider in providing a safety response that the client would be aware of, as well as some successful ways to work with them. Really more of a strength-based approach. And so that's the crisis line. And then mobile crisis is also 24/7, 365 days. And this can be accessed also by calling that same number, the crisis line number, 503-291-9111. And the mobile response, they will go meet these folks at their home, meet them on the street corner, meet them at a restaurant, a coffee shop, wherever that individual needs to be met, or where they might feel the most comfortable to be met, to ensure that they can do a crisis safety assessment and just get eyes on the person, and talk about different options to support whatever the concerns are at that moment. And similar to the crisis line, they create these safety plans for that immediate safety, but they can also help get folks connected to whether that's a higher level of care that's needed at that time, so the hospital, if needed, or getting connected to outpatient treatment services. And then the walk-in clinic, this is staffed by the same folks that work through the mobile team. And this is located right off the Max line, the Hawthorne Farms Max line. So it's very accessible to folks. And they're open right now, Monday through Friday from 9 to 2. And this is purely because of staffing issues. I'm sure it's not a surprise to anyone that the behavioral health field is struggling still, coming back from the pandemic, with just having enough people to support the folks needing help. But we're working on solutions to try and increase that support as much as we can. So in the meantime, we had to decrease the hours for the walk-in clinic, but that isn't to say that there's no availability outside of those hours. And so what is recommended is that you would call the crisis line, and they could arrange things with the walk-in clinic to meet that individual. And it's also just a really nice way to think about that experience of the client when not having to come to the walk-in clinic and sit there for some time, waiting to be seen by somebody. So it is pretty helpful just to have them, just to call the crisis line no matter what. And then they can get connected and even have like an appointment with the team there. So similar to what these other services, the mobile team, they do assessment, there's crisis counseling. They also do there's a substance use disorder team, who helps support folks that might need more of an evaluation around substance use. We also have peer support, family peer support, and they make those connections to treatment providers as well, and other social services that folks may need. Go over to the next slide. So the other component that is attached to our mobile team is our mental health response team, also referred to as MHRT. This is available every day from 8 a.m. to 11 p.m. If you're not familiar with this is a co-responder model. And what that is there's a clinician paired with a law enforcement officer that's trained specifically with working with people who are experiencing some behavioral health concerns. So the clinician, when they're responding to these situations, they are taking that lead, and the officer is there for support as needed. This is accessed through emergency services. So our crisis line doesn't deploy MHRT. This is only done if someone were to call 911 and that level of response was necessary. There could be safety concerns that are present, such as access to a weapon, actively suicidal, and the safety is at risk for all people getting involved. We would want to make sure that we had folks there that could support that level of crisis and keep the individual that's in crisis safe and everyone else responding. But the goal of this is to make sure that we can keep people out of the criminal justice system and have that clinical view as being the leading view of that level of support. And then, of course, there's the 988 crisis line. This is not staffed or contracted directly with Washington County. As you know, it's a nationwide crisis line. But we have agreements in place with 988 to where if there is a Washington County resident that is seeking support and they're needing mobile response or additional connections to the community, 988 has a specific line. They can transfer it over to our local crisis line, share the support so the person, or share the concerns and the needs with the clinicians so that the individual doesn't have to do that all over again. And again, get them connected with whatever resources locally they might need. And these two are also trained crisis counselors. And of course, there's 911 if necessary, and life-threatening. So that would be someone's actively suicidal, has a weapon in their hand, and cannot stay safe enough to have a conversation with a clinician over the phone. We would really want to make sure we get the support out there as soon as possible. So accessing services, again, the crisis line is 24/7 and you call that number. There's peer support specialists and clinicians. There's also a Latine mental health crisis support line. This is staffed by bicultural, bilingual clinicians. And there's a specific number for that. So I will update the information and send that back out to Lindsay so she can share that with folks if you would like that. The languages that are available are English and Spanish. And then for other languages right now, they bring in an interpreter for all of those calls. And then our mobile response team, we already went through like who's staffing that, but there's also bicultural, bilingual staff that are available throughout various hours during the week. And the languages that are available are English and Spanish. There are a few providers that speak other languages. I believe Mandarin was one of them. I can't keep top of my head. But again, this is located right off the Hawthorne Farm Max stop. And then the Hawthorne walk-in clinic is at the Max stop as well with the same staff that are staffing the mobile team. And then the mental health response team, we already touched on this as well. This is through 911 and its city police agencies in Washington County and the sheriff's office that partner with a LifeWorks clinician for that level of response. All right, so that's the high level view of the crisis services that we have. One thing that we really try to focus on the system care team is in that prevention lens. What can we do to equip our community to have the knowledge and the skills necessary to at least provide some first aid, if you will, for folks that are experiencing mental health concerns. And one way to get that support for yourselves or for your staff is to go to the Get Trained to Help website. This has free mental health and suicide prevention trainings that are accessible to anyone that lives or works in the Tri-County area. Right now, I just hired the mental health prevention and promotion specialist who will be working to get more and more trainings up on our calendar. It has been vacant for about a year because there's some restructuring of the position, but there'll be a lot more offerings coming up. But anybody can go to any of them that are across the Tri-County. It doesn't have to be Washington County specific. And then, of course, if there's anything specific you have for your organization, say there's a training that you need, or you have questions around suicide prevention policy, or, putting best practices into place after someone does die by suicide. We have our suicide prevention coordinator, Shannon Marble, who is very well versed and knowledgeable when it comes to suicide prevention work and postvention work across the entire state. And she is the one that's working to build and support all the policy and programmatic work when it comes to suicide prevention. And she's starting to move into the Zero Suicide Initiative as well for our county. So if you have any questions or needs around suicide prevention, mental health, go ahead and email that suicide prevention email right here, and someone will be able to get an answer to you and connect you, or create the training for you. And then I just want to highlight that if anybody was familiar with the Suicide Prevention Council that was attached to the Community Health Improvement Plan committees in public health for many years. It's been on pause because of shifts within the CHIP, but we are getting this going, and excitingly, we have been talking with University of Oregon to do a needs assessment around this for our county to create a specific plan and deliverables for Suicide Prevention Coalition. So Shannon Marble, who I mentioned just briefly, as well as Lonnie McQuilkin, who is the mental health prevention promotion specialist on this team, they are working to get this up and running with a potential kickoff meeting for community to come to and learn more about this coalition effort that will be coming into place. And again, this is going to be an effort to really take data and create objectives to move that needle and work to decrease suicide deaths in our county. There's a lot of information here, but this is the system of care team. And I just wanted to line this all out for you all in case the best way I can describe it is if you ever have any questions about what does behavioral health even look like in Washington County, what resources are there in Washington County, how can I become more versed in how to support somebody with a mental health crisis, just contact this team, because it's someone on my team that can help support or at least get you the level of support that you guys are looking for, or answer the questions. So we have two, Caroline and Corey, who are adult development coordinators. So they take the state funding, they work to sustain existing structures, and then work to also develop programming based on data to fill the gaps with whatever funding that we have, as well as looking for grants to apply for additional funding to support the needs in our county. Because as I'm sure you all are aware, there's never enough money for anything, but there's really never enough money when it comes to behavioral health and meeting the need in our community. So we're always looking for those opportunities. And then Shannon Marble, I've already talked about, and Lonnie McQuilkin. And then Nanette Lundeen and Andy Wallace. These folks are very versed when it comes to resources in our community, and provides very good trainings, presentations across the lifespan for folks. So, but if you have a hard case, these are the folks to contact. They do complex case consultations and help our community navigate what can be an overwhelming system to navigate if you're not used to it. And even if you are used to it, it can sometimes be very overwhelming. So again, don't ever hesitate to reach out. If anything, you can reach out to me and I at least know where to get you. All right, so I just want to do some quick high-level messages I'm hoping you all will take away is that crisis services are available telephone, mobile, in person, 24/7, and it's free. It will never cost them a thing. Crisis services are available in English in languages other than English. They're staffed by highly trained professionals and also people who have experienced mental health challenges themselves. And the individual defines what the crisis is. There's never a wrong reason. Just pick up the phone and call and say, I don't know what to do in this case. I worked on the crisis line for many, many years, and those were some of the best calls, is getting calls from providers in the mental health field saying, I don't know what to do with this individual who's experiencing suicidal ideation. Do I just send him to the hospital? And you have the time to really talk through the situation and figure out what is going to be the most trauma-informed, best case scenario and options to support this person. So please don't ever hesitate to pick up the phone and call. And then if you have any questions, again, about behavioral health in Washington County, just contact myself or our team, and we'll do our best to support you. That's about it. This is just me up close with my email. So I will stop sharing my email and just want to open it up if we have enough time, Lindsay or Charlie, to answer any questions folks might have. I'm happy to do my best.
Yeah, we have we have a couple of minutes. If whoever wants to raise their hand first, can get their question answered. But otherwise, you can always message and get your question answered that way. So if anybody has a question. Okay, well, if you do have a question, like I said, you can message. Sometimes we have to let the information sink in. Karen, we're getting close on time, so I'm actually going to move it to you can message the question. Thank you. Okay.
Thanks for
So
having
let's
me.
move.
Appreciate it.
Yeah.
Bye.
Thank you. Okay, we're gonna move on to Nathan Howard, who's gonna go over the pit count. Nathan, whenever you're ready.
Hi, yeah, good morning, everyone. I'm Nathan. I use he, him pronouns. I coordinate street outreach for Washington County, and I'll just give you a quick rundown of this year's pit count. So give me just a moment. All right, so most of you all are probably familiar with what the pit count is, or the point in time count, but I'll go through that really quickly. The point in time count is it's meant to serve as a snapshot of homelessness in a community and to provide a sense of the overall scope of homelessness in America. And every other year, communities such as Washington County are required, those that receive federal funding, operate a COC, are required to conduct an annual count of people experiencing unsheltered homelessness on a single night. We opted not to do the pit count last year and instead used our by name list data instead of that. This year, because we didn't do it, we will be conducting the pit count as required. It's the only mandated count of all people experiencing homelessness that happens annually across the country. So it obviously is a pretty important and significant data point. For you all, you're probably just interested in kind of the details around this year's pit count. So the count will be, the data point for this year is January 22nd. And our coordinated count will mostly happen the following day on Thursday, January 23rd. Activities can go until January 30th. that year. So any extra data that comes in late and things like that, we have until the 30th to get all that entered. But we're planning to conduct the bulk of our surveys on Thursday, January 23rd. Where this will be happening, it's all of Washington County. The goal is to get as much coverage as possible. And so teams will be both site-based at areas where we get frequent visitors, people accessing services, so day centers, libraries, things like that. And then also conducting the traditional outreach, canvassing through the county, trying to find folks in known locations using the expertise of our street outreach teams to locate folks and conduct surveys. So we will have kind of 5 geographic regions throughout the county with teams assigned to those areas, and then a hub location per region, kind of used to store supplies and deploy staff, outreach workers, volunteers out to conduct surveys and to kind of make sure that things are well coordinated. So again, who is conducting the survey? We are mostly, we're relying on our contracted street outreach providers to do the bulk of the work here, and then other staff volunteers from those SHS provider organizations that have street outreach teams. So partnering with our street outreach teams, using our existing volunteers from staff organization or from organizations that we work with already, which is, it differs a little bit from other counties' approaches. Some use a lot of volunteers from the public. We have opted to use our SHS provider organizations instead. So, and it's coordinated with our staff, our Washington County Homeless Services team, the cities, and then also Portland State University is the organization that they do the research component of that and are the lead for the pit count. So some just quick details. The survey is a 30-ish question, completely optional survey for folks to complete. And it's, again, just designed to capture the context around a person's unsheltered homelessness. So again, just to make very clear, it is optional. Folks can skip any questions that they do not wish to answer. They can stop the survey whenever they want to. And I will say that there was significant workshopping this year around questions that in the past have been kind of problematic. And so hopefully with considerable input from the community to kind of word questions in a less intrusive way, less, maybe potentially remove some of those more problematic elements and make folks feel a little bit more comfortable in completing the survey. But again, if anybody for any reason doesn't want to, they are more than welcome to not complete it at all, stop whenever they want to. So just want to make that piece very clear that no one feels coerced into having to do this, because it is, again, a very optional survey. So how you all can help, mostly just spread the word. If folks that you're working with might be nice to alert staff and other participants that you work with that this is happening. For folks who aren't familiar with it, who maybe haven't done it in the past, let them know kind of what it's about, the context, maybe the importance, and then kind of so if they are encountered, they have a little bit of understanding around what's going on, and no major surprises there. Again, drop-in centers will be conducting surveys. Outreach workers that they may encounter throughout the course of their normal day will be doing surveys again on that January 23rd. And you could potentially volunteer while we're not actively seeking volunteers. If you operate a site that regularly has face-to-face contact with folks who are unsheltered and feel like you'd really like to participate in conducting surveys, you could definitely contact me by the end of the week. We would need to know by then, because we do have the enumerator trainings, which is the training for the app that we use in the surveys. Those will be happening next week, so it would need to happen by then. But so you'll see my contact information down at the bottom. Feel free to, if you want to potentially volunteer, or if you just have general questions around pit count, any of the logistics, things like that, feel free to reach out to me, and I'd be happy to answer those questions. But that's all I have for 2025 pit count.
Thank you, Nathan. It looks like Cameron has a question in the chat. If we're working with new referrals to SHS housing services who are still unsheltered, folks who may or may not be connected to outreach folks as much as these days, do we give them where to go to be counted?
Yeah, we could definitely, if knowing their location, if they're going to be, Hillsborough, potentially it might make sense to have them drop into the day center over there, or a Beaverton, the library, or Home Plate if it's a transitional age youth would be good, easy places too. If they want to connect with an outreach worker specifically, you could just, Cameron, you could send me an email. I can make sure that that happens so that they're counted on the day. They do have to happen in person, so we can't do over the phone, just to make that part clear. But yeah, I would be happy to get somebody connected specifically if they want to do that survey. And then I
then
see,
Jorge,
yeah,
yes.
the other question around date. So the date for the data point is January 22nd. So that's the what we'll be asking about when the person was where they were staying on that night. We're planning to do the bulk of the actual surveys with folks on the 23rd, which is January, which is a Thursday. So if somebody doesn't get counted that needs to, we have until the 30th. So if we have a few extra surveys rolling in, we have till the 30th to get those. But our goal is to complete the majority of them on the 23rd.
Thanks, Nathan. Does anybody else have any questions? We have a little bit of time. Nope. Okay, if there's no questions, we can definitely move on. Let's see. Oh, sorry. Okay, agency highlights. Ryan McCulley is going to share about the BGA Safe Place program. Ryan, whenever you're ready.
Thank you so much. Appreciate it. Hi, I'm Ryan McCauley. I use he, him pronouns. I work for Boys and Girls Aid, and we have a safe place. And I will get my presentation up here. So please let me know if you're seeing the actual full thing and not just my notes and stuff like that. You good?
Looks good.
All right. Thanks so much. Yeah, so a safe place through Boys and Girls Aid. We're located in Hillsborough. Let me make sure I can advance here. We are a homeless and runaway youth shelter that serves youth ages 12 through 20 years old. It's a congregate youth shelter, but kind of like a individual room congregate youth shelter. We have 9 rooms and 13 beds that we serve youth with through there. Predominantly, we see mostly adults, but we are the only youth shelter that serves individual minors in Washington County. So that's just part of our role in the DNA of Safe Place. We've been around, oh geez, I think it's about, I want to say 17 years now. Started a ways back. We have again a cap of 13 youth, so a fairly small shelter, but it gets pretty full in there at 13. So we usually hover somewhere around 10. For the Washington County side, we're really fortunate this year to get 5 transitional age youth beds, which are a longer term stay, as we're finding that it's taking longer to get these young adults into apartments and into housing programs that we're so fortunate to have around here. And I think Christina will talk a little bit more about those programs. But we really do come in at the emergency shelter level. So what that means is that we have basic needs available. A lot of the same stuff as like a drop-in program. So we'll have food, laundry, a clothing closet and kind of a resource closet for toiletries, um, hygiene kits, wound kits, cold weather gear, all sorts of stuff that we can manage in that small space. For our residents and drop-ins, we do daily skill building groups. We have outings, recreation. Really try to give them the experience of still being a kid, even though they're moving through some really traumatic times at this really young age. And our goal here is to help them get stabilized and get housed and prevent the cycle of homelessness that leads from a young person who's homeless turning into an adult who's homeless. We have education re-engagement supports as well, and we do homeless prevention and aftercare. With that emergency shelter, again, we do provide a lot of walk-in services for our youth. We'll have folks that have stayed with us before, and maybe back into that cycle, or word of mouth, friends coming through and needing some services, and just a place to be safe and be out of the elements and get some of that support. We employ harm reduction services, so I'm sure like anybody working with folks experiencing homelessness, our relationship with expectations and folks meeting those expectations is probably a little different than maybe with the population we're working with when some of their parents are expecting to. So it is all youth driven and youth focused, and the youth has to want to be in the shelter. It's all voluntary. We don't have any locked doors going out of the building, so they can leave at any time. And if a parent is looking for us to like scare their kids straight, it's going to be a very rude awakening for them. That's not going to happen. They're probably going to enjoy being at the shelter a lot more because we don't have that same family dynamic and that same level of parenting response, as those of us who have kids kind of know that can roll out like. We have Narcan available, and again, because we work with minors, we work with kind of a different level of licensing and some requirements that we have within our shelter because we provide services to minors. So we're really excited to get a dispensation or like a change in the rules for that to be able to put Narcan out in our foyer and all throughout our building and just get it into the hands of the youth so that it's available when they need to use it. We also do training for Narcan with youth and with our staff. Food available all the time because of the population we're working with. Food insecurity can be a very big point or issue with them. And then we will do like we have those, I said, 13 spots, and we kind of have different buckets that I won't go into around all these, but we can do walk-in emergency overnight stays to try, even if we are full, to try to get a youth, safely through the night, and then connected to other resources directly after that. So for our minors, we prioritize our minors. Unfortunately, that means if we are full and a minor comes in, we're going to look for another option for some of our adults to stay at because there are other adult shelters available. Those minors situations can be oftentimes through family, we serve a lot of obviously a lot of youth from the LGBTQIA plus community, a lot of trans youth, where home might not be safe, and provide that support and recognition and safety for them. We also work with them to do some family mediation. I'm sorry, I just moved my monitor to try to get a better situation and it went blank, so I panicked there for a second. For minors, it's a 21-day stay to support reunification with family and guardians. Our first goal is to try to reunify with family, and most of the time that's how it works out. But there are some situations where returning home just isn't safe for them, or that's not what the youth is choosing. So at that point, we look for natural supports, other safe families, and adults that they can be with, maybe a family member or a family friend or some way, and then we work with them to create a host home agreement. We also work with Second Home as a host home program as a potential option for youth who are attending school. Um, and yeah, we try to get creative with whatever solutions we can find to help them get stabilized and safe in a way that they're going to be bought into it. Um, we do referrals to our transitional living programs and other host home programs, respite care and job corps. And we also provide a little bit of that release valve. So if a youth does reunify back home with family, we give them another 3 days within that following month that they can just show up and say, "Hey, I need a break. It didn't go well," and we can kind of try again. So we really try to be flexible and meet the needs as long as everybody's staying safe. We try to meet those needs. Yeah, and focusing on education supports, I will work with McKinney-Vento liaisons and schools to work out transportation. Washington County is kind of a big county, and also we're right next to Multnomah County, so sometimes there's some spillover from Multnomah County, and navigating that transportation to and from school is one thing, but also making it how do I say, in a way that a youth will still maintain their school attendance is really important for us too. So if there is a program that's closer to their home community or let's say in Multnomah County, we really try to work with our partners there to get them close to their supports in their community. For our adults and transition age youth, again, this is probably the majority of the youth we see, kids who are hitting 18 years old and living at home, and parents say, "That's it, my legal obligation is done. You go find your way in the world." Um, and they'll often be, not often, every time, be coming from high trauma backgrounds and situations that just don't have the supports and resources to make it in today's absolutely insane rental market and get an apartment. Um, so we work with a lot of our partnering housing programs, and this gives them some time to get through. So working with our Washington County Tay Shelter contract, that has a target date of or a target exit of around 100 days. We also offer what we call adult access, but it's basically just open adult beds for 30 days to try to get stabilized, and then hopefully that'll give us some time to move them into a more robust longer term shelter system that can give them the resources to get connected to housing programs. And again, I just want to state that these people are so resilient, these young folks are so resilient and come with so many amazing qualities and skills that it's just really inspiring to get to work with them. So with our stabilization and harm reduction, we provide hopefully a tranquil environment. It's a really big important thing to us to create, the calm place that they can be where there's so much chaos in their life. They should be able to come into a safe place and they've got enough other things to deal with. That environment, it's really important for us to create a place that's calming, relaxing, and that they don't feel that there's that extra agitation. So we really, I know this sounds silly, but we focus on light and sound, and we play lo-fi hip hop almost 24/7 just to keep the heart rate at a good pace. Personally, I am a big advocate of keeping fish tanks as a trauma-informed care practice. A little bit of nature does a lot of good for getting people, to drop off all those extra pieces, especially if you're working in an environment or a building that maybe was built for a more, um, I guess, professional facility type environment instead of a home environment. Our shelter was an assisted living facility before we took it over, so it's still got, the hallways and the office and all those pieces and all those little pieces of home just kind of bring it back to ways to connect with youth. So we keep live plants and we put youth artwork up all over the shelter. In fact, all the pictures in this presentation are artwork that was done by our incredible youth and pictures of youth on those outings. Um, for behavioral supports, we recognize that youth come with a variety of experience and skills and developmental stages, and so we work to meet them where they're at. Again, when we're working with parents, we're hearing about whole bunch of these behaviors, and then oftentimes we really don't see that in shelter. It's incredibly interesting how much of the environment impacts our youth and how they interact with it. So we use CPI, or crisis prevention intervention, to de-escalate. A big proponent of collaborative problem solving and looking at ways to work with youth who have repeated, predictable behavioral reactions, because we believe they're just trying to do the best they can with the tools they've got, and so are the rest of us. So we work to come to an agreement and a solution. And then we work a lot with safety planning and make reasonable accommodations when we can to support those youth in what they need to be safe. A little fish break here. Again, I'm a big proponent of the fish tank. So just like a shelter life, the roster changes every once in a while, but we keep lots of plants and fish around to it actually spawns a whole lot of great conversations with you too, kind of talking about and opening up about their history and past and the living animals that they've kept in their life too. Also, the youth take care of the fish and help out with maintenance. So we're building life skills throughout that too. Uh, Huge hearts with our kids, and they often want to take care of others before they take care of themselves. And this really opens up that conversation. So group skills and outings. Again, we're trying to provide an experience for these youth that they're still kids, they're still growing up, they're still cooking in that oven. So we want them to still be able to develop skills and grow and not miss out on those pieces of life just because they're in their situation. Um, Monday through Friday, we do a skill building group. It consists of all these things and more. We have wonderful volunteers that come from out of our board, from the community, who will come in and share. And I'd say, it's a really small group thing, so I try to prepare folks who come in. It may be 2 or 3 kids that are there. Other kids are at school. We might be a low census. It's a pretty small shelter, but even that small individual connection of 1 or 2 kids, like it's just such an impactful thing to have an adult who is there and focused on you and is listening to you during that time. So those are usually pretty highlights of the week when we have folks come in and share their passion with our youth and all that. We also have partnering agencies. I want to shout out Vicky with Washington County Health Department. Does the best sex ed class I have ever seen. Um, Please reach out to her if you have any needs for educating people about safe sex and sexual health. Other volunteers, and DVRC is a great partner of ours too. Comes out and does a healthy relationships group. Um, we also go on outings. Again, trying to have that regular kid experience: libraries, movies, swimming, sports events, arcades. Um, it's a pretty fun shelter, to be honest. And then I'll wrap up here with just our mental health support. I think we all know that mental health is a major part of the work we do with folks experiencing high levels of trauma. Um, and you're right. There's never enough money out there for behavioral health and for mental health support. So we work with partners and work with the people we have on site to do those weekly mindfulness groups, emotional regulation kit is a new evidence-based program that we're starting off actually this month that we're really excited, partnering with Jackson Street Youth Shelter to share what they've done with this program. Um, and we obviously do suicide assessments, suicidal ideation, uh, safety planning, and work with the crisis team too on all that. And then, of course, make referrals to mental health resources. Hawthorne Walk-In Clinic is a pretty good partner of ours as well. So, in wrapping up, we have an environment that's focused on our youth and young adults. It's kind of, especially that young adult part, I would say, like there are some really fantastic investments from the community and the county in creating adult shelters in Washington County. And a lot of these 18, 19, 20-year-olds just aren't ready for that level. And this creates an environment that's kind of a step into that. So they're still young folks. They still get they have their peers around them. And we find that that's a really supportive environment for them. We prioritize minors. We have a pretty short-term stay, 3 weeks for minors, about a month for adults, and then if they can get into those day beds, we can extend that out to about 100 days or more. Yeah, if you have any questions or thoughts, or you have, especially like anybody you want to refer to us, please just call the shelter at any time. My information's up here as well. We can screen and yeah, keep doing this work to hopefully produce less homeless adults down the road. And I'll hand it back to you.
Thank you, Ryan. You guys are doing some awesome stuff. I love it. We're going to move on to Christina Martinez, who's going to talk again from BGA about hosting services. So Christina, whenever you're ready, go ahead.
Thanks. It's actually housing services. I saw a little typo.
What did I say?
Hosting. I saw it in the agenda too, but just to clarify.
Okay, awesome. Sorry.
No worries. Thanks everyone. Good morning. My name is Christina Martinez. I use she, her pronouns. I'm the Director of Housing Services at Boys and Girls Aid. I oversee our transitional living programs and our supportive housing programs. So I will share my screen here. Let's see. Let me know if you guys can see that. Can you guys all see that? Yes. Okay, great. Okay, so I wanted to start really by kind of highlighting the fact that Boys and Girls Aid has really developed a shelter and housing continuum. And as you heard Ryan talk about, we provide homeless prevention, emergency shelter, and all the way to our transitional living programs, to our housing case management services. So really coming from impending crisis to literal supporting literal homelessness, short-term support to long-term support. So we're really fortunate to be able to have all of these services in place to support everyone at different levels of need. The programs that are offered in our housing realm, we've got transitional living programs and our supportive housing services programs. Our Compass and HUD TLP operate very similarly in the services that we provide and the case management available. I think the biggest differences would be the eligibility requirements. Our Compass is specifically geared toward youth involved in DHS, aging out of foster care, receiving aftercare services, or currently involved in DHS. Our HUD program eligibility has homeless status requirements and income requirements. And then we've got our supportive housing services. Again, I think the work that our case managers do is very similar, and the services that we provide. I think the length of stay is one of the identifying differences. Rapid rehousing is a 2-year shorter term program, whereas HCMS is really for the duration of the funding. It's meant to be longer term. More specifically, the TLP services that we provide include housing for up to 24 months in either our agency-owned fourplex or one of our leased apartments. This is a difference from our SHS programs in that we master lease. And so the youth that come into these programs are not responsible for their own leasing. This is a way that we can create or that they can create positive rental history. It provides a safety net if they fall and fail, and they won't fall too far because they've got us to kind of lean on. They're not responsible for a lease that may, if they get lease violations or evictions, those are not going to go on their rental history. We offer employment and educational support, assistance with connecting to community resources. We want them to be self-sufficient when they leave us, and so helping them develop a network of resources that they can access is really important. We offer case management and case coordination, life skill building. Our case managers work one-on-one with youth as well as facilitate group skill building that cover a wide range of topics to help increase self-sufficiency, including housing readiness education. And we also provide aftercare services. Let's see, our SHS services, I think our case managers do a lot of that same stuff. There is a level of independence that folks coming into these programs need to have, in that they are going to be on their own leases. Our SHS programs help with long-term and medium-term housing options, crisis stabilization. These case managers really help folks go through the entire housing process, from getting their documents in place to obtain housing, to apartment searching, the application process, writing letters of accommodation, really supporting them moving into their own apartment. And then everything that comes after that in maintaining their housing, budgeting, learning how to pay their bills, apartment upkeep, really anything involved in case management that they can do to support folks in staying housed. That is the goal. And then we really do operate under a model of progressive case management. And it really allows case managers and case managers and youth to work together to provide service plans that really meet their specific need. Case managers may work more closely and more often with folks in the beginning, but the idea here is to progress out and increase self-sufficiency, increase income so that they can do it on their own. And then I do want to just highlight like the growth that we've had at Boys and Girls Aid in our housing department. I think previously we were only operating with TLP programs, and we've been able to expand and develop our supportive housing programs. So we've gone from 20 youth serving in 2022 all the way to 101 youth in 67 households. Which is really exciting. And I think that we want to continue to grow and continue to serve more youth. The youth that we do serve, we are specific in our population in that we serve transitional aged youth between the ages of 18 to 24 that have either population or A or B homeless status. And then more specifically, our compass is geared toward DHS youth, as I said before. We do get our referrals from a number of places. For our SHS programs, we now only get our referrals from phase 1 assessments through the county matching system. We no longer, from county guidance, receive internal referrals. So any referral that we get for those programs is going to come from the matching system. In our TLP programs, historically, we have gotten referrals from Safe Place, which is really great. Again, it kind of speaks to that continuum of care. Home Plate Youth Services and other community partners, schools in the area, mental health agencies, and DHS and ILP. The last thing I do want to highlight, because this is available to all of our participants in all of our housing programs, is our food pantry on site at our Beaverton office. And so this is stocked with non-perishable food items, hygiene supplies, other household items. And we have donations come once a month, which is really amazing. And then our case managers have wonderfully developed relationships within the community to kind of supplement items, so that we can keep that stocked throughout the month for our participants. Typically, case managers will, or participants will reach out to case managers to coordinate time to come on site to pick up items when they're in need. And then at times, case managers will deliver items as needed. And I think as our program has grown, we are looking to expand donations, to make sure that we're serving more youth, and so we need to make sure that this is stocked. So, and that is all. I do have, we're celebrating 140 years. That's really exciting as an agency. My contact information is here if anybody has questions after today. Feel free to call or email me.
Thank you, Christina.
Thank you.
Okay. So Lindsay did not receive any requests for a public comment. So I think that we're going to move into general business. Gary Smith from Veteran Services will discuss updates on VASH, on current data, resources, and new staff. So Gary, whenever you're ready, go for it. You're muted.
Thank you. Happy New Year, everyone. I think Lindsay was maybe going to share my slides. Yeah, I got a little bit of information around vouchers and things. I think I'll do that towards the end. My slides, though, around the emergency transitional housing and GPD programs that we have at the Salvation Army facility there on Farmington Road, which I'm very happy to say they put about over $5 million into this building in the last couple years, and now the facility just feels brand new. So it's been kind of a nice transition for us, but quite a couple of years to get through all the process of construction on site, and really made it for less openings for homeless veterans there. So we're now fully open, though. I want to say last August or September, everything kind of got up and running. So we have 58 beds there that we have for homeless veterans and their families. And this consists of veterans with even children. We don't have a lot of big family rooms, but we have a couple of rooms that are actually well situated for families. And then we have double rooms that are a decent size that you could get a small family into. So just been nice to see all the updates. Yeah, this building, I think they've been there for about 11 years, and I've been working at this program for the last 8. So it's a fun, energetic kind of facility where we have a lot going on, a lot of service animals and companion animals, and a lot of groups on site, which is nice to have. They have a chaplain. The Salvation Army has a chaplain. They have 3 amazing case managers, which is a big part of the program. Some of the unique stuff there I did highlight in the program information is that we do enforce 2 breathalyzers a day, which is very unique. It's the only program that I know of in the area that's really doing this for our veteran programs. So there's that. There's curfew at midnight. There's random UAs, of course. But to me, the basis of the group is of the facility really is the veterans working on their goals and really focusing on trying to improve their situation. So that comes up a lot of times with 3 main areas around the financial, of course, housing, and then self-determination areas, which ways that are veterans in trying to improve their health or sobriety or just everyday life stuff. So we have a lot of great life skills groups there on site and a lot of good activities going on for the veterans. Yeah, so it's been a lot of fun for me to work there for as many years as I have, and it's been good to see the growth in the facility and all the changes. So a lot of good things going on. They do 2 meals a day. Breakfast is more of a simple cereal and toast and things like that. Every Thursday we do screenings. So around 9:30. I always say to get there around 9 because lately it's been getting kind of full. Yeah, go ahead and next slide, please. So this is for when we do our screenings on every Thursday. This is some of the information that we usually ask the veterans about, just to see what their focus is for the program and what maybe some of the challenges are going to be for getting housing. We have a lot of pliability, of course, with VA options for housing, but that includes SSVF, which is Supportive Services for Veterans and Families grants, and also the VASH vouchers. So there's options sometimes for housing. And then, yeah, we asked a lot of questions around, their legal status, their status of substance use, mental health, medical. It is a big facility. It's got an elevator that usually works. That's one thing that didn't get done in all the capital grant updates to the building was the elevator. So that elevator sometimes will have issues. So we do have 3 ADA rooms though on the ground floor. So it's kind of a nice setup there. That's actually brand new, which is excellent to have. And go ahead and next slide. Yeah, I kind of like this one. Shows where the VA is at the star and then where our facility is on the other little dot. So proximity to the VA is quite a little skipping down the road, but we actually in Hillsborough have a VA outpatient clinic. So that's kind of a good setup. Next slide. I think it gives an aerial view, which is kind of a nice view. We're located actually right by a campus of a school there that goes over to TV Highway there. So it's kind of an interesting setup in a nursing home there to the right. So yeah, it's kind of an interesting little setup there with the school behind us, but we make sure everything is real safe. Next slide, please. One of our redone hallways. Next slide. There's our lobby, which is not an updated slide. The computers are actually in the other room next door nowadays, and the flooring's been a little redone, and the furniture is a little newer. So some updates, but our general lobby when you walk through the front door. Next slide. This is one of our rooms. This is kind of a double room. So before it used to be a shared kind of living spaces for veterans. And nowadays with this capital grant, we were able to create all the rooms into single rooms. So we have a smaller setup for the single rooms. Usually this is more of a room that would be for a family. And then I didn't take a picture of all the bathrooms, but the bathrooms are really nice nowadays. Some of them have small showers. Some of them have a little walk-in kind of tub situation. Next slide, please. This is our dining hall area. So lunch and dinner are full meals. And like I said, breakfast is more of a kind of create your own. Sometimes we get a lot of donations of breakfast items, and then there's cereal and toast and sometimes fruit. Next slide. It's our outside back area. Right now, the raised beds are cleared out. So, and they just redid a little greenhouse that's attached to the dining hall area. So it's going to be interesting to see. This last summer, though, we had a lot of good gardening going on and got a lot of good produce out of the garden, which has been excellent. Next slide. And this is the side of the building, and you can kind of see an ADA door there on the side. So that the ADA setup it's a little tricky, I would say, going from bus to that ADA door. So you got to be able to navigate those sidewalks and the little curb. But got a decent ADA setup door. And then, like I said, 3 ADA rooms that are very, very well set up. Lowered countertops and rolling showers, grab bars everywhere. So, yeah. Next slide, please. I think this is our last slide, actually. So, probably hard to see this one, but it does have our walk-in hours. The Portland is listed real clearly there, that 808-1256 phone number, 503. It's for all of our Portland area for walk-in hours for homeless veterans. So to get into our program, we're one of the, we're the only one in Washington County that has a transitional housing program for homeless veterans, but Portland has about 3 other programs. We have another program up in Longview, Washington, a small program in Vancouver, Washington. Salem, we have 2 programs. So there's a variety of programs. Washington County, they're now doing some walk-in hours also for people, so which is nice to see. It gives an option for homeless veterans to go to our CBOC there in Hillsborough. Oh, sorry about that. So yeah, every Thursday, I think they're doing the walk-in hours there, which is a couple days a week there. Sorry, not every Thursday, but let me find it out. Second and fourth Thursdays from 10 to 1, they have walk-in hours, and that's in Hillsborough there at 1925 Northeast Stuckey. It's right by, it's kind of an interesting building there. It's right by the Macy's in that Tannisbourne area, right down the road. So yeah, and then some
Gary,
information.
I hate to cut you off, but I'm going to give you like 10 more seconds because we got to move into our next announcement.
Oh, no problem. So Washington County vouchers right now, we have about 272. We're hoping to get some new ones flowing in here in the next couple months. Metro area, we have quite a few vouchers. So just good for homeless veterans to look at the walk-in options or come to our place every Thursday around 9 o'clock. Thank you all. If you have any questions, please reach out.
Thank you, Gary.
Yes.
We're going to move quickly on to Kim Marshall, who's going to talk a bit about the Solutions Council whenever you're ready.
Hi guys, I can make this really quick because Nicole already shared so much of what we're doing. I think I have a lag. I apologize. We are talking about budgets and budget reductions and metro reform. Our meetings are public, like Nicole said. So our next meeting is Thursday the 16th at 2 p.m. You can join us in person at the Department of Housing offices or online. We do have an opportunity for public comment at the beginning of our meetings. We're just diving into the hard discussions that are being had. So we just went through an application interview process, and then taking to the Board of County Commissioners, adding 4 new Solution Council members. The plan is to do that about once a year, depending on our need and openings that we have. So we're very excited about that, and we'll be introducing them in the next few months once the board approves those nominations. Okay. Happy Wednesday.
Thank you, Kim. So I'm just going to move on to announcements. Our next meeting is going to be February 5th at 8:30 a.m. Please reach out to us. You can email Lindsay about, suggestions around agenda topics and agency highlight interests. I'm going to leave the last 5 minutes to encourage people to unmute or put in the chat any events, if you have any kudos or highlights, etc. So if you have anything at this last 4 minutes, feel free to unmute.
Hi, my name's Michelle. I'm just going to jump in because I was about to send Lindsay. I need to go. If Lindsay could please put the flyer and the survey in the chat. I'm with MHAO. We're partnering with OCHS, and we have put together a statewide survey for folks with housing insecurity in the last 3 years. We're trying to gather information, hopefully getting, needs like wraparound services and such, so that it can make a difference for the future funding. And people, it's a longer survey. It's about 10-15 minutes sometimes, and they can get a $10 gift card, which is actually put in by a person. So sometimes if they're doing it on a Friday night, just let the people know, have some grace, it'll come. So that's it. We have a flyer. People can, there's what are those QR codes? And then there's also a survey link, and you're welcome to print it out, put it wherever, you know, in the vet services place, you know, in the homeless kids. Just, sorry, I'm not using my words very well, but you're welcome to share it all the places. So thank you so much. I need to roll. I have another meeting. Does anyone have any questions or anything?
We will send out a recap message with the link and the PDF file as part of just the follow-up.
Beautiful. Thank you so much. Have a great day, everyone. Thank you so much. It was all wonderful information.
Thank you. Anybody else? Last 3 minutes. No? Okay, I'm happy to give back 2 minutes of your time. Thank you so much. And to our presenters, this was a really interesting and informative session. So thank you for that. Happy New Year, everybody. I'll see you again on February 5th. Bye. Have a good day.